Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening, and thank you for joining us for another edition of Sports Doctor, brought to you by Cross Keys Physical Therapy, with locations in Washington Township, Woodbury, Sicklerville, and coming soon to Pennsville. I'm Joe Chapana. Tonight we are live and we're talking general sports injuries. We'll take your calls regarding questions you may have about injuries you may be suffering with. Our toll-free number is 1-888-634-7488. Locally, it's 856-767-8884, and we also have an email address if you prefer to email your question to us. The address is wpsjtv@aol.com. Now, Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks, and at the end of the program, we'll give you the numbers to contact Cross Keys directly to set up an appointment to take advantage of that offer. But for right now, questions regarding general sports injuries, 1-888-634-7488. With us tonight to answer your questions, we have Dr. John Salvo, who's an orthopedic surgeon with Cooper Sports Medicine, and they're located in Voorhees in Washington Township. The Voorhees office is at 900 Centennial Boulevard, Suite A in Voorhees, and in Washington Township, it's Bunker Hill Plaza in Sewell, New Jersey. And to his right is Dave Anselmo, who is a physical therapist with Cross Keys Physical Therapy. And while we were on break, Dave became a father for the very second time. Congratulations to him.
Thank you.
Great to have you here. What suggestions would you give to someone who is starting to exercise following several months or years off from exercise?
I'd recommend anyone who has not participated in an exercise program for 6 months or longer to go see their family physician, just to clear any underlying factors that might limit their ability to participate in an exercise program in a safe fashion, like cardiac problems or orthopedic problems that might cause further problems to occur. It's best just to get them checked out first and prevent them so they don't cause any further problems.
See your doctor first. Dr. Salvo, being outside, playing sports or exercises, that can pose different risk. What other areas should athletes and coaches be aware of in preventing injuries?
Well, one of the things, especially at this time of year with the increased heat, is dehydration, and that can decrease your reaction time. So the coaches and the athletes and the trainers should be aware of that, and they can be increased incidence of injuries if an athlete is dehydrated or has decreased reaction time when training in the heat.
And what do you recommend, water versus energy drinks?
It's either water or energy drinks, but it's more frequent stops, not training in the middle of the day, practices in the morning and the evening when it's a little cooler out, and more frequent stops and keeping an eye on the kids and make sure they're not getting dehydrated.
Okay, and this is the time of year, they're supposed to be working out all summer, but a lot of fall athletes don't, and now they're trying to kickstart it into high gear. Dave, people in this situation, what should they be aware of?
It's very true. Well, hopefully they won't get into that situation. They'll train, they'll do a lot of, we stress a lot of pre-season conditioning, stretching and strengthening, to better prepare these athletes to go into their sports. But unfortunately, they don't do that all the time. So you see a lot of sprains, strains, muscle pulls. Basically because they come right back into the sport and they think that they'll be able to just jump right into it and not do any warming up exercises as well. They need to stretch and to warm up to get the blood flowing through the muscles and the joints to prevent injury from occurring. And you don't see that happening, and therefore you see a lot of these sprains, strains, inflammations.
And a very unusual summer this year because it's really been relatively cool until now. And the weather, of course, now is a big issue. What can a parent or an athlete do to prevent heat stroke or overuse problems?
Well, as the doctor just nicely explained, dehydration during hot weather activities is very dangerous. And it could also actually be fatal if it's not watched very closely. I recommend for parents that have a child that is going to go involved in an exercise program, for 2 to 3 hours prior to the activity, I recommend them to drink 2 to 4 glasses of water, obviously depending on the size of the student or the person. Or during the activity, I recommend them to drink 1 glass of water for every 15 minutes of playing. So hopefully there'll be a lot of periods of stopping, especially playing in hot weather. Another way of checking it as well is at the end of the performance, for every 1 pound of weight that they lost, body weight, to drink 2 glasses of water. will help to hydrate them and prevent heat stroke from occurring.
Good formulas here to remember. Toll-free number to reach us with questions tonight. We're talking general sports injuries. It's 1-888-634-7488. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy. Our first caller is Sean. Sean, welcome to Sports Doctor. What can we do for you tonight? Sean, are you there?
Yes, I am.
Hi, how are you?
Good, good. I have a question for the doctor, Dr. Salvo. I'm 34 years old, and I've had knee surgeries on both knees for torn cartilage, medial meniscus. And I've noticed I've been walking a little bit, and I've noticed in a long-distance walk that it feels like my right knee will kind of lock up, or it feels like it's not strong. It's sort of like flimsy, and I have to stop and sort of like make an adjustment with my knee. And I know when I had the surgery, I had some, not all the cartilage, it wasn't fixed, it was cut out, but it was more damage to the right than the left. And that was about 9 years ago, and I've just started to notice this. I was wondering if you had any ideas what this might be.
Well, are you having swelling with your knee as well?
Any swelling, Sean?
I'm sorry?
Any swelling with your knee?
No, not really, not a lot.
The things we watch out for that we get worried about are either having sharp pain, swelling in the knee, or if the knee is giving out on you. If any of these things are happening, it could be a sign of cartilage degeneration inside of your knee, and you may want to get checked out either by your family doctor or by an orthopedist. But if it's just soreness and achiness, that may just be because you're walking a little more and you're putting a little more stress around your knee.
And someone facing cartilage degeneration, what options do they have?
It's really dependent on the age of the patient, the activity level, and the amount of degeneration. There's a wide spectrum of degeneration. It can start out early with the meniscus and the cartilage, which it sounds like Sean had, and it can go down to arthritis, where you get loss of your motion and chronic pain in your knee.
Okay, Dr. John Salvo with us, an orthopedic surgeon from Cooper Sports Medicine. Also Dave Anselmo, physical therapist from Cross Keys Physical Therapy. It's Sports Doctor. We're talking general sports injuries, 1-888-634-7488. If you have a question, call us now, toll free. Dr. Salvo, let's talk about supplements like ephedra. With hot weather coming up, people wanting to lose some weight quickly. Are these a good idea?
Generally not. There's been a lot of press, especially about ephedra recently, and it is a supplement that actually increases your metabolism and your core temperature. Everybody's always looking for a quick fix to lose weight, and I don't think any of the quick fixes really work. But ephedra, because it increases your core temperature, especially in the heat, it can be dangerous. When you combine that with dehydration, and then again, as I said, the hot weather plus increasing your core temperature with the supplement, it can end up with a dangerous and devastating consequences.
I guess that's why they have those warning labels on.
Well, that's actually why a lot of the major drugstore chains have pulled ephedra supplements off of their shelves.
It's a dangerous thing. Okay. Phone call, 1-888-634-7488. We have Kelly on the line from Stratford. Kelly, are you there?
Yeah.
Hi, what can we do for you tonight?
Hi, I have a question for Dave.
Sure, go right ahead.
Hi, Dave. I was just calling in reference to shin splints that I have.
Okay.
Is there any possible way that I can stretch them any differently than just a regular?
Well, stretching is important for shin splints, but more importantly, we want to try to prevent them from occurring. Usually it's from you're doing some type of running, I imagine. Kelly?
I'm sorry?
Are you doing a lot of running?
Yeah.
What type of surfaces are you running on, Kelly?
Concrete.
Okay, well that's probably your biggest problem right there. The shock absorption on that is causing more of the trauma to occur at that junction that causes that to happen. All right, so the shin splint. So I recommend you to do a couple things. One, check your shoe for absorption. You want to make sure you're running with a good shoe. Secondly, you want to run on surfaces that are more absorbent, like tracks or gravel, stuff like that, something that gives you a little more absorption. Or if you're running on a treadmill, you want to run on one that has a very good deck. Those are little things that will help you do stuff like that. But stretching and icing afterwards will help you, but you really want to prevent it from occurring as a parent to continue to do that. Also, running in the same direction. You want to change your direction up. If you're a chronic runner that likes to continue to run in the same direction, I recommend you to change up your direction of running. That also has a big effect on the shin splints.
How do you do that on a treadmill?
Well, on a treadmill, it's hard to do it on a treadmill, but believe it or not, I do have people walking backwards on the treadmill as opposed to running and doing things like cross training, do a little bit of EFX, and do things like that. Do the bike, don't actually just do the treadmill.
I heard that that's actually harder to do, training backwards like that.
That's correct.
Okay, there you go. Good tip there for you, Kelly. Sports Doctor, 1-888-634-7488. Jack is our next caller from Williamstown. Jack, welcome to Sports Doctor. How are you tonight?
Thank you. Very good. Very good. Thank you.
What can we do for you?
I have a question for the doctor, Dr. Salvo.
Dr. Salvo.
Yes,
Yeah.
Jack.
Doctor, when I'm sitting down for a while, I go to get up, I get a really, really sharp pain in my knee. I got to just rub it and stretch it out before I even get up. Now, this happens quite a bit.
Okay. How old are you?
I'm 50 years old.
Okay. And how long has this been going on?
Oh, I'd say about 3 months now.
All right. Is it? Does it feel better once you actually get up and you walk around?
Yes.
It does.
Yes.
Okay. And does your knee swell?
No.
No. Okay. Well, it could be a lot of things, and it could actually be early degeneration of your cartilage or arthritis. But the fact that it doesn't hurt after you get up and you get that sharp pain, the things we worry, sharp pain is concerning, and if that's continuing, then you really should be evaluated either by your family physician or an orthopedist. But I would if it's only been a couple of weeks, I would give it a little time.
Okay, Jack, thank you for watching. Thank you for the phone call. I want to remind you that Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks. And at the end of the program, we're going to give you the number to schedule an appointment. Right now, you can reach us, though, toll-free at 1-888-634-7488 with your questions about general sports injuries. George has done so. George is from Burlington, and he's our next caller. George, are you there?
Yeah, I am.
Hey, what can we do for you?
Yeah, I'm 53 years old, and I used to play soccer. And apparently, I tore the ligaments and the cartilage are all gone. And I had a surgery where they had a pin placed in my knee. Apparently, it seems to be that it's kind of loose in there, and I'm feeling some tinglings under my foot. Now, what would you recommend or suggest for that?
Well, if you've had ligament surgery, and it sounds like you had a significant injury to your knee, if you said you're having tingling down in the bottom of your foot?
Yes, sometimes my toes get kind of numb.
And your knee does it feel like it's loose?
Yeah, I'm beginning to feel some looseness in there.
Okay, when was your surgery?
The surgery was done 4 years ago.
4 years ago, okay. With the concerning thing is with the tingling, that with your knee being a little bit loose, that you're stretching the nerve and you're getting a little bit of tingling from that. So that's the kind of thing you really should be evaluated in the office, and somebody should examine your knee and get new x-rays just to make sure everything looks okay.
George, thank you for watching, and thank you for the phone call. Sports Doctor tonight, general sports injuries. You can reach us toll-free, 1-888-634-7488. Dr. John Salvo with us from Cooper Sports Medicine in Washington Township and Voorhees, and also Dave Anselmo from Cross Keys Physical Therapy. Washington Township, Woodbury, Sicklerville, and coming soon to Pennsville. Our next caller is William from Philadelphia. William, are you there?
Yes, I am.
Hi, what can we do for you tonight, William?
Well, Doctor, I heard you speaking before about ephedrine, and if you don't mind taking one more question about ephedrine, I would like to ask one.
Sure.
Please go right ahead.
Okay, I've been taking ephedrine for I would probably say about a year. I take it 3 or 4 times a week. I take it as the label directs, which is 90 milligrams, not to exceed 9 milligrams a day. I take it sporadically just for like a little bit of energy and some fat loss.
Okay.
And the amazing thing is, because I know you say about the high blood pressure and hypertension and all that, I don't get any of that.
Okay.
I actually work in the OR. I'm actually a nurse, so I monitor my blood pressure very carefully, and every day it seems pretty constant. 117/64 or somewhere around that range. I've never had hypertension, and I'm just starting to really kind of question what the people are saying about ephedrine. That is really individualistic. Does it depend on the person, or is it?
I think a lot of it does depend on the person and your dose. And what you're doing when you're taking it. If you're working out in a gym, most gyms are going to be air conditioned or climate controlled, and that's going to help you. And then if you're drinking water or just rehydrating yourself while you're working out, that's important. And ephedra is certainly used by a lot of people, and they haven't had problems with it, but it can if you overuse it or if you use it in the wrong conditions.
William, thank you for watching. Thank you for the phone call. You are watching Sports Doctor, brought to you by Cross Keys Physical Therapy. Tonight we're talking general sports injuries, and we're going to take a short break, but we'll come back with more of your phone calls if you'd like to reach us with a question. 1-888-634-7488. Also, we're taking your emails. The address is wpsjtv@aol.com. More of Sports Doctor right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
Oh, you're lucky, young fella. Mm-hmm. You know, hospitals didn't even use ether for your procedure until about 1846. Yeah, slap on a few live leeches, grab a hacksaw, get to work. Of course, we don't use leeches anymore.
It's fun to know history. Find curious facts from America's past at loc.gov, the Library of Congress website.
We are back at Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Washington Township, Woodbury, Sicklerville, and coming soon to Pennsville. During the year, we're here every other Thursday night at 9. In the summer, we're on a bit of a break. This is our first summer show, but we'll be back Thursday, September 11th with another edition of Sports Doctor, and then we'll be into our fall schedule. Right now, though, you can reach us with a question about general sports injuries at 1-888-634-7488. To answer your questions tonight, we have Dr. John Salvo, who's an orthopedic surgeon, Cooper Sports Medicine, and they're located in Washington Township and Voorhees, and also Dave Anselmo, a physical therapist with Cross Keys Physical Therapy. And again, we'll give you numbers for Cross Keys Physical Therapy at the end of the program to take advantage of that free evaluation offer. Right now, though, if you'd like to reach us toll free, the number is 1-888-634-7488. Let's say hello to Rob from Philly. Rob, are you there?
Yeah, how you doing?
Good, Rob. What's happening?
I got a question for, I guess, the surgeon.
Dr. John Salvo, go right ahead.
There you go. I do a lot of weightlifting, and now when I bench, my one shoulder cracks and pops.
Okay.
And it's starting to get painful, so my bench keeps going down and down and down. What's causing that?
Flat bench or incline? Or both? Rob?
Yeah.
Would that be when you do flat bench or incline or both?
Yes, and a flat bench.
All right, what about inclines?
Not as bad.
Any other shoulder exercises that hurt it, or doing curls or anything like that?
No.
Okay, how old are you?
35.
35. Okay, a lot of times in weightlifters, did you say you're a bodybuilder too, or just a weightlifter?
Yeah.
All right. A lot of times in people who are lifting a lot of weights, especially when they get into their 30s and 40s, they can start to have some shoulder problems, and it can actually be it can be anything from a little bit of tendonitis to a tear in your stabilizer or your labrum. If you're having cracking and popping but it's not hurting, that's not so concerning as if you had pain with it as well.
And of course you do. So there is someone that could possibly take advantage of the free evaluation offer that Cross Keys Physical Therapy is putting out there for the next 2 weeks. And at the end of the program, we'll give you the number to schedule an appointment. Right now, you can call us toll free, though, at 1-888-634-7488 with your question. Soccer question for you, Dr. Salvo. It's one of those sports that's year-round now. And does this year-round competition increase the injury? And if so, what injuries are you seeing?
I think the most common area injured in soccer is knee injuries. You see a lot of ankle sprains as well, but knee injuries I think are more common. With year-round playing, just by the number of times you're out there and in competition, that would increase your risk for injury. But then the athletes are so much better trained now too, being year-round athletes. They actually have their muscles trained and their reaction time is very good. I think it's just more the frequency of playing. If you're playing 20 games versus playing 50 games in a year, you're automatically going to have a higher risk to be injured.
Just the odds increase.
Yeah.
Now, what about the link between female athletes and ACL injuries?
Well, female athletes, it's been shown when playing in organized competitive sports, high school and college level, they're 2 to 8 times increased likelihood of tearing their ACL compared to males playing the same sports. It's really multifactorial. It's because their ligaments are a little smaller, their reaction time of their muscles is slower, and it's just the way they're built, and it's also a hormonal factor. We can't put our finger on one thing that causes it. It's really multifactorial.
Okay, we'll talk about ways that can prevent that in just a second, but first let's talk to Pat. Is it from South Jersey? Pat, are you there?
Yes.
Hi, go right ahead with your question.
Thank you. When I buy trousers or suits, my one leg is always quite a bit shorter than the other leg. How do you measure, and what would you do with unequal leg lengths, and how would it affect your sports performance? Say if your left leg is half an inch or 3/4 of an inch shorter than your right leg. What kind of injuries, and how would you even, for the people listening, how would they even measure if a leg length is off?
First of all, is that something that's a problem?
Most people do not. Most people's legs are not exactly the same length. Most people will have about up to a half-inch difference between their legs. Usually it's about a 1/4 inch. When you get to a 3/4 of an inch or an inch, then it could be something either you're born with or if you've had an injury with the way something is healed. To measure it yourself is difficult. You really have to go from a bony prominence above your hip down to the bone and inside aspect of your ankle with your knee straight. Kind of hard to do by yourself. Unless you're very flexible. So one way to check it is to get your family medicine. Get in with your family medicine, your internist, and you can tell them what's going on. And if there is a significant difference, a heel lift in your shoe can make a big difference for your performance.
Or you can check with your tailor, too.
Or you can check with your tailor.
Way to diagnose that, too. Thanks for the call, Pat. Toll free, 1-888-634-7488. Let's talk to Frank in Upper Darby. Frank, hello, how are you?
Hello, how are you, doctor?
Good, we're all good.
Listen, I have a question. I got a 15-year-old son, runs cross-country and indoor track, and he complains about his heels all the time.
Okay.
I'm just curious if these new sneakers with the shocks on the back are any good for cross-country.
Has he just changed his sneakers recently?
Pardon me?
Has he changed his sneakers or his shoe wear recently?
No, he just wears a lightweight shoe, a good a good cross-country shoe.
Most of the running shoes on the market now are actually pretty good with their cushion and their shock absorption. The thing you don't want to do is you don't want to run them into the ground, especially with cross-country runners. You don't want him to wear his shoes down because that shock absorption capacity will wear out, depending on how many miles he's running a week. So that's something you want to keep an eye on.
How often should one change their shoes?
It really depends on how many miles they're running, probably every few months.
Okay, back to the phone lines, toll free, 1-888-634-7488. Next caller is from Vineland. Henna, are you there?
Yes.
Hi, welcome to Sports Doctor. Your question tonight?
Yes, I just have a concern. I recently started lifting weights and doing different exercises, and I'm doing lunges and squats, and I'm having a lot of strain on my knees. I don't have pain particularly, but it's a lot of strain on my knees. Is there anything that you could recommend that I do to alleviate the strain and to continue doing the lunges or the squats?
Painful knees from lunges or squats?
Well, Doctor and I were just talking about this earlier. I highly recommend that you maybe have an athletic care trainer or someone that trains in your gym take a look and watch how you're doing it, because you're probably not doing it properly. And by not doing it properly, you can actually cause some problems in the knee joint that you really don't want to get involved with. So I highly recommend you to if you want to, take advantage of the free evaluation, and we will show you how to do it and how not to do it. So that's probably your best option now. And if you don't want to do that, ask in your gym if you have a trainer that could help you, instruct you in what you're doing and what you're doing improperly.
Okay, Henna, and for everyone else, we will have the number for Cross Keys Physical Therapy at the end of the program. So if you want to schedule that free evaluation, you can do so. Right now, though, you can call us toll-free with a question at 1-888-634-7488. Is Donna there? Donna, welcome to Sports Doctor.
Thank you. I have a training question, and I mean this very seriously. The people you see in the circus and on TV commercials that are extremely flexible, they can bend over backwards, that kind of stuff, is that attainable through years of stretching, or is that some sort of anatomical difference? And no matter what you do, the average person can't do that.
No, usually that's the way they're born. People are born that flexible. You can't really make yourself that flexible. Now they can make yourself a little more flexible in a few degrees, depending on the joint you're talking about. But the people in the circus, contortionists, people in Cirque du Soleil, that's the way they're born.
Although we did get out of the same small car for the show.
We were in our clown suits.
Back to the phone lines. Arthur from Cherry Hill, are you there?
How you doing?
Good.
Quick question. A couple years ago, I had knee surgery for a meniscus problem. I played a lot of tennis, and over the years it just wore down. I'm 50 years old. I had the surgery, and 3 months later they took another MRI, and it was torn again. I had a second surgery. 3 months later, if you could believe it, again, another MRI, and it was torn again. There comes a certain point that something like this cannot be fixed?
A lot of times it depends on how much of your meniscus or the shock absorber is torn in the knee. It does, when you get to a certain point, it does start a downhill slide for the meniscus because there's only about 20 millimeters that you're born with. And each time you go in and take a little bit, once you get past like less than 5 millimeters left, you're basically without your meniscus.
Okay, we're going to have to take a time out here, and I want to give you the numbers for Cross Keys Physical Therapy. If you'd like to take advantage of the free evaluation offer, you may do so by scheduling an appointment. In Sicklerville, the number is 856-728-1900. Woodbury, it is 856-853-0988. Washington Township, 856-374-3707. And don't forget, coming soon to Pennsville. Keep watching for future shows. Our next one, by the way, Thursday night, September 11th. Please join us for that. I want to thank Dr. John Salvo for being here tonight. Again, an orthopedic surgeon with Cooper Sports Medicine in Washington Township and Voorhees. His Voorhees number is 856-325-6677. And in Washington Township, it's 856-270-4150. Dave Selmo, as always, good to see you. Dave from Cross Keys Physical Therapy. Until our next show, you have a great summer. I'm Joe Ciappana. Stay well.